And our panelist and call-in partner is Adelina Marshall, at VA employee and mental health RN for over 30 years. So you know she is talented and inspired. And our discussion today will be on disparities and racism in the healthcare industry. Welcome, welcome, Adelina.
With Kelly, Glenda Smith, and American Hero iHeartRadio for this partnership on healthcare matters. I'd like to out with a platform that United Nurses, National Nurses United, has just posed, and is a platform respecting protesters' rights, no use of lethal weapons. We want to support comprehensive and system reform, racism in public health, which is in crisis right now, and reinvestment in the community and healthcare system. Some of the discussed today is that disparity in of care for the general public, and also some of the things I'll be quoting is already printed in the Department of Veterans Affairs, Health Service Research and Development, Ford Magazine, and various other publications relating to health care among minorities as well as Hispanics.
Okay.
Go ahead.
No, saying okay. I'm
okay. Mm-hmm. So some of the things that I'd like to point out is that some of this shows in the communication and commitment to our minority veterans and minority patients all over the United States and probably in other countries too. And part of this disparity in community that is needed to promote health is time disparity. Sometimes our patients may need more time. A lack of black providers in many areas. It is shown that our black patients prefer to engage with, as part of their care group, black healthcare providers. We know, for instance, that many of our nurses who are working in the medical field experience bullying and intimidation daily. We are advocates for our veteran care as well as the care in the community. And many times our suggestions or observation are second-guessed and overlooked. And the patients do pick up on that. They are very aware of how they're treated. And we are their voice. We are their voice to stand against substandard care.
Oh, yes.
Substandard education, lack inclusiveness, the outcome, what is better for our patients, because and we've worked with them, and we are minority patients ourselves.
Mm-hmm. Yes.
We also know the hazards that healthcare that our patients are exposed to, and that's at a very young age this starts, and it impacts their blood pressure, mental health, and overall general health care. Salt, sugar, refined foods, air and water quality, poor education, environment, mental health needs that are not met. And when our community have an increased arrests, it disrupts that family stabilization. And therefore, it causes the children family now to become housing, have housing and food shortage interruption, lowers income, and this causes many other problems. There's a mystery as to why healthcare issues. The mystery, why is it not being addressed?
Yes. So what do you think needs to be done to address it?
Well, we have to do more education in our community. Education needs to start in lower school grades, more communication, print media, Twitter, all the things that we as a public participate in and information, there needs to be more healthcare ads. It's women's health care. They need to start at a younger age to inform young women of their needs, yearly exams of certain kind of cancers, certain vaccinations that are available to them. So we need to start with more education, I do believe. We need to have a race-neutral policy. So many times our veterans will come to us and their complaints are ignored. And that's part of the communication that's needed. Support them and to encourage them and to remove their fear from health care. One of those are for cancer treatment, which oftentimes minorities wait to get treatment. They don't heed signs. So we have to do more communication and bringing that about. The VA is taking steps to try to improve communication among our veterans and in the service and abilities of clinicians. However, every VA is different, so the healthcare disparities are different among each VA.
Very good. Yeah, so you were talking about the need for education and more communication and the need for, really, I'm a really big advocate of the influenza vaccine every year and it's free to our veterans if they go in and get their care done. And I, look at that, but there's a lot of myths out there and misinformation. What kind of things would you want to address if you were trying to really address these myths and miseducation and misinformation?
Okay, so let's start with the influenza vaccine. We are hoping that this year that many of the population takes it, especially our veterans and minority, because with COVID-19 is very prevalent in our communities, and you don't want to get the flu and then become also infected with COVID. So while I'm not a scientist, that flu vaccine is very important and becomes more important every day with these various viruses that's going around. We also need to talk about distancing, social distancing. We're very social people, and that can expose health issues. And wearing a mask. I work in a hospital. I'm just appalled at how many of our veterans and staff, even though we have a policy, will try to come into the hospital without a mask. It's just amazing. So education, education, education. Please understand the severity of this COVID. I don't even know how it affects their lungs. And if you are infected and you get you are fighting for your life. You're fighting for hospital beds. You're fighting for ICU. And if our medical staff become infected, then who's going to care for you?
That's right. That's right.
That the entire staff has become infected and not able. There are only so many doctors, so many nurses who are in ICU that can actually help to support your recovery. So please, please, please consider taking that flu vaccine.
Oh, very good.
Another thing I'm noticing with health disparity is some of the stores that we shop at.
Okay.
I now see where the hand sanitizers are $19, $30 for a large bottle that perhaps before this happened, it may be $3.99. Some stores offered it for $1. If you got to spend your money, a lot of people work right now. They're going to buy food and their necessities for their, but that hand sanitizer is now a necessity. And so I do wish our state and local governments would look at that and why these prices are going like that. I know there's supply and demand, but it's easy to produce hand sanitizers.
Yes, because that's right. I've heard about that with the price gouging and people taking advantage of people, during a crisis. And we should be working to try to save everyone's life, not just to do that, to make money off of someone else's misery. And
Right.
the one other thing too is that you were mentioning wearing a mask, social distancing, getting the influenza vaccine early, probably in August rather than waiting for a secondary pandemic wave to come up, and you're going to have people
Right.
with the flu going into the healthcare system at the same time. COVID patients may show up. You can actually get both at the same time.
Both of those are respiratory,
Yes, yes,
and your lung only have a certain capacity.
that's right. And
You really do not want to be infected by both.
that's right. And so, what do you think it is that people need to know about the services, the mental health services at the VA, and why it's so important to support these bills that are coming out now for veterans who are seeking mental health care? Was talking to a caller about the National Defense Authorization Act and how the Centers for Traumatic Stress and Deployment Psychology are being affected right now, and there are cuts in the bill, for 2022. So we've been talking about that, but you think we need to be putting more emphasis on mental health and not less?
I think we need to put more emphasis on mental health, and not only with our veterans, but the family of our veterans also may need support. During the COVID, I worked at an injection clinic, and our patients started coming in monthly or every 3 months for injections versus taking pills.
Yeah.
I think that should be increased so that it includes more compliance with the management of their illness. And then I am concerned with the children now, with all the social unrest, the impact it's going to have on that. So we do need more mental health practitioners, more mental health nurses. I filed a report the other night because we didn't have enough staff. We felt that since our census was down, that it was okay to lower things, but it's not. This is the time that the patients that we be more inclusive, spend more time with them, more interaction,
Yes.
In the communication with them and them on what's available to them. Not the time to cut staff. I mean, we just had a incident in Muncie, Indiana, where a nurse was attacked and also police officers working there. So it can be bad. It can be bad on the family who is worrying about their loved ones who have mental health issues, the staff that are caring for them, and the patient themselves. They want to feel secure. They want to feel stable. And I, as a mental health nurse, need to have the time to pick up on what their needs are. What are they thinking about? Making sure that they're not thinking about self-harm or harming somebody else. So it would be very surprising to me if the VA is actually, or Congress is going to allow them to cut funding at a time when we have more coming into the VA. This administration trying to cut back on affordable Obamacare. So if you're out there and you need care and you no longer are able and you're a veteran who's chosen to go into private sector, I would encourage you to come back to the VA. We need more. We have increased funding for using VA care, and their satisfaction rate up, while our male satisfaction rates have gone down. And again, it's an impact on our Black male veterans. We need to do more to make them feel welcome and secure coming into the VA system. We need to do more with promoting our Black nurses in the VA system.
Yeah.
We need to get rid of their proficiency, how they're rating them, because it's another way for disparity. And if they can make more money, some of them will leave. We need to make sure that they feel comfortable at the VA. We're not at the VA for pay because we make far less than prevailing rates in the community. We are there for our veterans. But our nurses have to be respected, and our observation and our education needs to be respected. and we need to employ more Hispanic nurses and more black nurses and make them feel welcome coming into the VA.
That is fantastic, that statement, because, what I feel about the nurses at the VA, because I've seen great improvements, over the last decade or two. I'm a combat veteran myself, so I deal with some issues myself. But they are true public, servants. They're cut from the same cloth as the veterans are. Some of them are veterans themselves, but even those who are not are cut from the same kind of dedicated cloth that really serves our veterans, and we should be proud of that. And I think we do need to have more African American and Hispanic nurses in the VA system, so people see a familiar face and feel comfortable with that. And
right. Our patients will confide in us before they will confide in anyone else. I understand the language that we use.
Yes.
Others will not. I am not a veteran, but as you pointed out, many of our staff are veterans. And I'm telling you, if they think that we're dropping the ball on the care of our veterans, they will read us up and down.
Yes.
So this is the place for our veterans to be. You need the VA. And we don't want them to dismantle the VA. I'm not sure how much longer I'm going to be at the VA, but I'm there not because of a career path, but because of a dedication to our veterans. I have family members who are veterans, and I lost a family member as a veteran to mental health issues. So I am very dedicated, and I know that every nurse there is just as dedicated. Every black nurse. I'm the one that defends them. I'm the one that sees the file of minute things that they'll bring up, but they won't bring this up for other nurses in the same capacity. So we have a big concern about that.
Yeah, so
and I wish that Durbin and other politicians would look and have an investigation called for at the VA, but to our patients and related to the staff who works there. They need to look at that very closely.
Yes. And one of the things that I'm actually as a combat medic, but a physician too. And one of the things that I always, kind of really floored by is when people walk up and say, we need to teach some of the people who are actually taking care of people who are Hispanic or African American, we need to teach them cultural competency. And I said, well, I can save you money. Let's start off with the people who are African American, Hispanic, and put them into the role of being the provider. So, we can save a lot of money just by getting the people who are available. We have very dedicated and brilliant people in our community with incredible resources and incredible competencies. And so, I really echo everything you've been saying about that. And so how can the general public and our veterans organizations, our veterans themselves, get involved with trying to support these kinds of needs that you have within the VA?
Every opportunity I get, I tell the veterans that you own the VA, that I work for you, and you need to set a standard of expectation. And we have open door policies, but you can't come in and let them twist your concerns as to attack the staff. When we're staff, you're not going to get what you may consider the same services you at the hospital that is fully staffed. Are they having staffing ratios? No, they're not. You should come in. You should ask, do you have enough RNs, doctors, other providers to provide me the health care that I have earned and deserve? And I also want to point out about prisoner health care and human rights, LGBTQ community, because we do serve that also at the VA. And some of our veterans have experienced imprisonment. So we want our veterans to be able to get the same kind of health care when they're in prison. If we can go there and make sure that whatever they're entitled to, they can receive that also while in prison, that they have a pipeline back into the VA once they get out. Their health care is impacted once.
Yes. And I know we have a problem with, substance abuse and homelessness among veterans. Is there anything that you think we should be, particularly aware of? And how can we, how is that addressed, first of all? And what are the things that we can be pushing for to make sure that those veterans are treated correctly? Because I understand what you're saying about, making, setting the needs for expectations. But we need to be, I guess, is there a way we can interact with, sending messages to our legislators, to people in the VA system that we are concerned about our fellow veterans?
Well, I often thought about the homeless situation, and during the Obama administration, he did work very aggressively to improve the homeless situation. But, we have barracks. There's one down on Roosevelt that is sitting empty. Why not open those barracks and allow our patients to come there and receive maybe a prolonged treatment to for substance abuse, and some job education and training while they're there, and services. I never understand that you're going to tear down the bases or and we have housing available. Have to think out of the box on how to make it. I know nobody's out here, but I just feel that if it is selling drugs or harming a veteran, if they are, I don't know, if they're caught for doing that, I just think the punishment should be a little bit more, just like with senior citizens. I just think that the public needs to know what they're doing to our veterans, and we do know it's a big problem. We do know that.
That's really very insightful.
That's a show. Many more shows will be needed to address that. But I'm sure the public and the veterans themselves should be included in any discussion. We could start there. Let's see what they feel their needs are. We should not be dictating everything.
Yeah.
Other people do have a voice, and we should listen.
So what's the location of the barracks again? You said on Roosevelt Road?
I think there's one on Roosevelt Road. I used to take one of those streets that come down, but I'm sure we can find out where they are. Okay. And there are also warehouses that can be converted to apartments. Okay. Where everything can be inclusive there for our veterans.
Thank you very much. It's been great having you on.